This is Henry Ford Hospital 1915, home of the Henry Ford Medical Group. This is it today. Not much has changed, except maybe everything. So as we exit a year of celebrating the last 100 years, we thought, why not look into the future?
10, 20, 100 years out.
In the next decade or so.
In 50 or 100 years.
50 years from now.
Over the next 100 years.
100 years from now.
It turns out we've been trying to guess what the future of medicine would look like for a long time, often with dubious results.
6 minutes program calisthenics.
Oh, that's ridiculous.
Although many times wrong, it's this kind of thinking that has brought us some of our most fantastic innovations. Not that fantastic, but certainly this fantastic. So we asked Henry Ford Medical Group doctors their ideas for the future of medicine and just how the group might be in the middle of it all, just like they were a century ago.
You know, if I'm going back 1916, I'm sitting here just before World War I. If you would have told me that man would have made it to the moon in this century, I'd have said, you're crazy.
Over the next 100 years, there's really no limit to what might be possible in the future of medicine.
Yeah, when you look forward 100 years, that's a pretty daunting task.
I don't know what the future holds in 100 years.
That's a good question.
Looking forward 100 years, you're tempted to just kind of jump into this science fiction mode. You think about microbial engineering, you think about sort of untwisting the human genome.
Nanoparticles and nanobots that can be directly injected into a patient's blood vessel.
The future is very bright and the opportunities are really limitless.
With technology, I think, comes a lot of wonderful innovation.
We will have advanced the treatment of conditions like stroke, conditions like heart attack, even conditions like diabetes.
We're going to be able to treat and minimize the impact of disease to a much greater extent than we've been able to do in the prior 100 years.
One of the exciting things in the future is that I might be able to go to a patient's bedside and scan my tricorder and gather all the information I need from that.
Could it really be like the Star Trek age where you wave the magic wand and things get better? That would be awesome. I can't even wrap my mind around that, but it has to be going there.
The power of technology to transform medicine electronically we're only just now starting to discover that.
Being able to stop cancer from happening before it happens is of utmost importance. We may be treating cancer with purely just medication. There's something as little as a pill.
I'm hoping in the future that there might be some injectable medicine that we can give rather than just giving TPA, but something to actually bring those cells back immediately.
I think the heavily invasive surgical procedures will tend to fade away and be replaced by minimally invasive or even, non-surgical solutions for a lot of these conditions.
Cancers that I deal with now, by removing the entire or part of the organ, may be dealt with by more targeted agents or ablative therapies where there are no skin incisions anymore.
When you think about the future, it's hard to imagine a need for a physical structure like a hospital anymore.
People will be able to go onto their computer, type in their symptoms, type in their diagnostic information, pull information out of their medical record.
I see a lot of doctoring or medicine happening right through your own computer or laptop or television, in which the doctor is in their office and they're counseling you based on the symptoms that you're having.
Our research is going towards stem cells and through genetics. I think genetics will play a key role in medicine, say 50 to 100 years from now.
And this is something that's been working on now, but I think that in the next 20 years, we'll probably see much more of it, is the ability to grow tissues and organs in the lab and also do 3D printing of parts and organs.
Henry Ford, I think, from the beginning has really fostered a network of physicians that have been tasked with thinking about the future.
I love coming to work and being able to work with amazing colleagues in multiple disciplines and to try to tackle a problem in a new way.
In order to be part of the future or to be the pioneers in the future, we can't take the easy way out.
If you're not thinking about new options or moving forward, then I think you're falling backwards.
Being bold enough to investigate things that seem a little bit different and wild and out there initially, I think will be some of the greatest catalysts for the evolution that we need to see in healthcare.
The Henry Ford Medical Group has the really critical perspective of always keeping the whole person in personalized medicine and always taking into account each individual's needs and quality of life.
Not being satisfied with the way things are, wanting things to be better, is sort of a fundamental building block for advancement in the future.
In some regards, some things don't change, over 100 years.
If you look at Henry Ford's mission and vision, it talks about transforming people's lives. It talks about making people's lives better.
You really have to be intellectually curious. You have to try new things. Sometimes you'll fail.
But always to have an eye for what's next, what's better.
We're going to bring more of Henry Ford Hospital into the lives and homes of our patients.
With precision medicine, genetics, there's so much more that we're going to have to know.
But what the new cancer center will do is it will bring us all together.
We will be personalizing breast cancer management by evaluating the genetics of an individual patient's tumor.
And we're going to continue to figure out ways to fix the heart without actually doing incisions.
So it turns out, without curiosity, there can be no innovation, and every failure has something to learn from. That although fantastic and unknown, these pursuits, this exploration, is critical to the future of medicine and the care of patients, which is why all of this exists in the first place.
Our bodies have a limited mileage, and so even when they're not ravaged by chronic disease, we're going to have to really focus on how to keep our patients healthy and able to make the most of their healthier bodies now that we're able to take care of these diseases, and help our patients have the kind of lifestyle and outlook that we would want them to have to attain their goals, to live not just a longer life, but a better and higher quality of life.